Good morning to you. Thanks so much for joining us, whether you are watching us on TV or perhaps online. I'm Farah Nasser. We are awaiting the Prime Minister's daily address. He's expected to speak any moment now outside of Rideau Cottage. Here is a live look and ahead of today's virtual meeting of the House of Commons. Now, while we wait for the Prime Minister to take the microphone, let's take a look at where the numbers stand, because Canada has now passed another grim milestone in this pandemic. As of minutes ago, more than 70,000 Canadians have now tested positive for COVID-19. Almost half of those cases are considered recovered, but more than 4,900 Canadians have died of COVID-19. We do have some positive news to share with you. The number of new cases in Canada continues to drop. BC reporting 23 new cases, Alberta reporting 47 new cases, as the province's chief medical officer there says she's encouraged by that news. Low single digits in both Saskatchewan and Manitoba. You can see that on the map. Quebec reporting 748 new cases, the majority of which are right now in the Montreal area. The federal government has also announced $2.5 billion in aid for seniors struggling financially. Minister of Seniors Deb Schultz and the Treasury Board President unveiled the details this morning. Here's how it works. Seniors eligible for old age security are going to receive an additional one-time payment of $300. Those who qualify for the Guaranteed Income Supplement will receive a one-time payment of $200. The deadline for GIS payments has been pushed back to October 1st. Officials estimate that the new support will help 6.7 million seniors in Canada.
We know that our elders have built this country. We have an enormous debt of gratitude to them. They also, in many cases, literally fought for our country. They are my parents, they are your parents, they are our parents and grandparents. We need to look after them. We have a duty to care for them, and to this morning's announcement is exactly in that context.
The government also announced $20 million to expand the New Horizons for Seniors program. Our global news team is standing by to bring you the very latest on the COVID-19 situation, both here in Canada and around the world, because there's a lot of news internationally. Michael Couture is in Ottawa, and we're going to start with him. Micah, we expect the Premier to come any second now, but what are we expecting to hear? Oh, never mind. You know what, Mike? He's coming now. We'll chat with you on the other side.
Hello everyone, bonjour tout le monde. Avant de commencer, je veux d'abord souligner le fait que plus tôt ce matin.
First of all, I would like to say that earlier this morning, Minister Gould announced a new contribution to support the Gavi Vaccine Alliance and the World Initiative for the Eradication of Polio. These organizations distribute vaccines to the most vulnerable throughout the world and save millions of lives. More recently, Gavi also has helped developing countries to respond to outbreaks of illnesses such as COVID-19. Once we will have found a vaccine, Gavi will help with the distribution to those who need it. This is good news because in our interconnected world, we need to end the pandemic in Canada, and we also need to end the pandemic throughout the world.
Earlier this morning, Minister Gould announced a significant contribution to the Vaccine Initiative, Gavi, the Vaccine Alliance, Gavi, and the Global Polio Eradication Initiative. These organizations deliver vaccines to some of the world's most vulnerable, saving millions of lives. Most recently, Gavi is also helping developing countries build capacity to respond to disease outbreaks like COVID-19. Once a COVID-19 vaccine is available, Gavi will help get it to the people who need it. And that will keep us all safer. Because in our interconnected world, to end this pandemic for good in Canada, we have to end it everywhere. Comme on le sait trop bien,
as we know, the past few weeks have been particularly difficult for seniors and their families. Our parents and our grandparents are more at risk for COVID-19 and to suffer through horrible consequences. Throughout the country, the long-term care homes and seniors' residences have been the most hard hit by this pandemic, exposing the cracks in a system that need to be strengthened. But The challenges for seniors are not only limited to what's happening in the long-term care homes. The quarantine is difficult for seniors throughout the country. They're spending a lot of time alone, isolated from their families. They have to avoid leaving the house as much as possible, and they're not able to use transit. They depend on delivery services, and this oftentimes means that they can't benefit from sales. Times are difficult. It's difficult emotionally and financially. Today, our government is announcing measures to help seniors to go through this crisis. First of all, if you receive old age security, you will receive $300 extra to help with additional costs because of COVID-19. Countrywide, we're talking about 7 million people who will receive more money over the next few weeks. To help seniors who are the most vulnerable, we will also provide an extra $200 to all those who are eligible to the Guaranteed Income Supplement. This means that if you receive both old age security and a Guaranteed Income Supplement, you will receive a total of $500 extra. Our government will also give $20 million extra to the New Horizons program for seniors. We brought changes to the program a few weeks ago to allow affiliated organizations to change and modify their services to help seniors to stay in contact with their families. We're investing in this program once again to provide more activities to improve seniors' lives.
Today, our government is announcing new measures to support seniors during this pandemic. First, if you're receiving old age security, you will get an additional $300 to offset some of the extra costs you've had to cover because of the virus. This means that across the country, almost 7 million seniors will get help that they need. And to better support the most vulnerable seniors, we will also give an extra $200 to people who are eligible for the Guaranteed Income Supplement. So if you're receiving both OAS and GIS, you will get an additional $500 in total to help you. Our government is also investing an additional $20 million in the New Horizons for Seniors program. A few weeks ago, we boosted funding so that organizations could provide delivery services and help seniors stay in touch with family during the pandemic. So we're making another investment today to create more programs to help isolated seniors and improve their quality of life. Now, there's no question that COVID-19 has been taking its toll on seniors both emotionally and financially. And with today's announcement, our government is taking action to alleviate some of the stress they may be feeling. But there's a lot more work to be done, not only to find short-term fixes, but long-term solutions. COVID-19 has exposed some uncomfortable truths about our society, including how we care for seniors in Canada. We've seen heartbreaking tragedies in long-term care facilities and nursing homes right across the country. Overworked staff, understaffed residences, grieving families. There are serious underlying challenges facing these facilities, and in the coming months, the federal government will be there to help the provinces find lasting solutions. Depuis le début de la crise, on a été témoin.
Since the beginning of the crisis, we have seen heartbreaking situations in long-term nursing homes. We've seen understaffed facilities, grieving families, and serious underlying challenges. They have huge challenges to overcome, and over the next few months, the federal government will be there. We will help provinces to meet these challenges.
No matter where they live or what they do, has a role to play in supporting our seniors during this pandemic. It starts with following public health recommendations. You know the drill: staying home, washing our hands, and keeping a safe distance from others when we go out. That's how we can protect the physical health of our parents and grandparents during this pandemic, But let's not forget about their mental health. A lot of people, especially single seniors, are feeling really lonely right now. So call your grandparents. Ask them how their day is going, how they're doing, and how you can help. Consider writing a letter or a postcard to isolated seniors, or volunteer with a local organization to fight the isolation of seniors. We need to be there for those who have built this country for the rest of us, and that's what Canadians will continue to do. And together, we will get through this. Merci.
Thank you, Prime Minister. We'll now go to the phone for questions. One question and one follow-up. Over to you, operator.
Thank you. Merci. First question, Raymond Filion, TVA. À vous.
Bonjour, Monsieur le Premier ministre. Au sujet de l'aide aux...
With regards to assistance for seniors, first of all, the amounts that you're announcing are not enough, according to what some groups were asking for. The Fédération d'Âge d'Or were asking for monthly increases. Is this the best that you can do, 2.5 billion, if we look at the 9 billion announced for other groups? Since the beginning of this pandemic, we knew that our seniors would be the most vulnerable faced with COVID-19. This is why we took many measures as a society to try to protect our parents, our grandparents, to stay home, to stop the spread of COVID-19 throughout the country. We also took concrete measures. We provided help to United Way. We had a provincial sales tax refund, and now we're taking an extra measure to help the seniors that are having extra costs and increased levels of anxiety. Since the beginning, we've concentrated on those who lost their revenue. For example, workers who lost their jobs, or students who won't have a summer job to be able to pay for their tuition next year. As you can see, we will be there for all of society so that we can go through this crisis. That is what Canadians do. We support each other, and this continues today.
From the very beginning, we recognize that seniors are particularly vulnerable to COVID-19 as a disease. That's why in our exhortations to make sure that everyone stayed home, we often talked about the need to protect our parents and grandparents by slowing the spread of the virus, by keeping people safe. At the same time, we did move forward on direct measures to support most vulnerable seniors through organizations like the United Way, and the GST return that was increased is going to help significantly a large number of seniors. But today, we're announcing more help because we recognize that every week seniors are out of pocket a little bit more for costs of filling medication prescriptions more frequently, or delivery costs for groceries, or other things that they're challenged with, which is why we're stepping up on sending seniors the help they need.
Mr. Viray.
Au sujet des CHSLD, vous en avez parlé dans votre allocution. Il y a Monsieur Singh.
We spoke about the long-term care homes. Mr. Singh was saying that the private care homes should be closed and everything should be nationalized. Are you looking at this as a possible solution? What is going to be the solution? To transfer money to the provinces? Do you see a more active role for the federal government? It's not up to the federal government to find the solution for the CHSLDs. We recognize the leadership and the jurisdiction of the provinces. We will be there to help provinces in finding solutions. I think that Canadians throughout the country are asking serious questions as to how we're going to take care of our seniors, and they will ask that in the months and the years to come that improvements should be made, and it will be up to the provinces to determine how this will happen. The federal government will be there to assist, to support provinces in assisting them in bringing forth changes.
Line open.
Yes, Prime Minister. Thanks for talking to us today. The Deputy Prime Minister suggested yesterday that traffic between the U.S. and Canada is bound to increase as states and provinces reopen. What specifically is the government planning to do to deal with an increase in inbound traffic from the U.S., considering the risk of infection?
We're going to continue to be very careful about vectors of infection into Canada. That means continuing with restrictions on international travel. At the same time, we have brought in measures that means anyone coming into Canada, returning residents, particularly, will need to self-isolate for 2 weeks. We are looking at stronger measures to make sure that we're following up appropriately on people come over, because as we know, as economic activity starts to ramp up, as restrictions get loosened across countries, it is likely that we see a few more people either returning home or a few more people trying to cross the border. We need to make sure that the measures that we're bringing forward are going to keep Canadians safe.
Follow up, please.
And given the recovery challenges that lie ahead, is now the time to ensure that all Canadians, especially non-salaried workers, have access to affordable childcare?
I think one of the things that we've seen, particularly when many of the very first jobs lost during this crisis were ones held by women, disproportionately held by women. The need for childcare has never been made clearer. That's why we will continue to work with provinces and municipalities on ensuring that there are affordable childcare spaces across the country. As a government, over the past 5 years, we've made significant investments in childcare, and we will continue to do that. It is a responsibility that we share with the provinces, and we will continue to work with them to ensure that they are able to deliver the kind of childcare that is needed for our society. Okay.
We recognize the extent to which daycares and early childhood centers are important so that people can get back to work. Since the beginning of this pandemic, many women have lost their jobs. And when we are going to try to reopen the economy, we have to make sure that there are enough spaces in daycares and early childhood centers. And we've been there since the beginning of our mandate 5 years ago to invest to help provinces to deliver daycare services. We will continue to be there in order to continue this conversation with provinces and to make sure that we have a better daycare system throughout the country.
Curry, the Globe and Mail. Line open.
Good morning, Prime Minister. Your announcement yesterday, your government's big business loan program will require companies to produce reports on how their actions contribute to national climate change goals. The initial reaction from oil and the gas sector was that most large energy companies are already producing reports like this. So is this just a matter of asking companies to maintain their existing level of climate reporting, or are you asking them to do something beyond that? And if so, what would that look like?
Yeah, as you pointed out, there are many companies in the energy sector that are already taking seriously the need to plan for the longer term, to plan for reducing emissions and fighting climate change, but not all of them. And that's why we needed to make sure that as we move forward on support for large companies large employers across all sectors, that they are also in all sectors, not just in the energy sector, thinking about the challenges that climate change will pose to their company and to their future, and have a response for it.
And again, on the loan program, it's clear that large companies that have been convicted of tax evasion don't qualify. But yesterday in your comments, you went further and you said that the government will watch for, quote, aggressive tax avoidance. So what does that mean in practice? Will this rule out companies that use offshore tax havens?
I think Canadians expect that if we're going to be putting taxpayer dollars, public money towards supporting these companies, that they be paying their fair share of taxes. We recognize that companies have often very complex ways of managing and structuring their revenue and their portfolios. But if they want to apply for the large enterprise emergency financing facility, they are going to have to demonstrate a level of transparency that shows how they organize their structures, so we can make determinations around whether they are indeed paying their fair share of taxes before we put in Canadian money. Okay. Nous reconnaissons que beaucoup de grandes compagnies.
We recognize that a lot of larger businesses use different structures to minimize taxes that need to be paid. Canadians expect that people who will receive public money will have paid their fair share of taxes. We require a certain level of transparency from these big companies to demonstrate that they have paid their fair share and that they're not using different means to avoid paying their fair share. We will make sure that if they are to receive public funds, they are making an adequate contribution to this public money.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Merci beaucoup. Bonjour, Monsieur Trudeau. Vous avez annoncé...
Mr. Trudeau, you announced financial help for workers, for SMEs, for families with the increase to the Canada Child Tax Benefit students. Yesterday, big business. How are you going to explain to seniors that they are last? No. On the contrary, ever since the beginning, we've been thinking about seniors. We recognize that they were the most vulnerable to COVID-19, given their health status and their age. And that is why, ever since the beginning, we took measures to protect them, whether encouraging people to stay at home, to not go visit their grandparents, to make sure that we are helping them through organizations such as United Way, to provide more money by returning the provincial sales tax. We have taken many different measures to protect seniors. Today, we are doing something more. We are going to send a check of a $300 check to almost 7 million seniors throughout the country, with a bonus of $200 for all those who are receiving the guaranteed income supplement, because these are the most vulnerable seniors. We need to support all the different sectors of the economy. We recognize since the beginning that those who had lost their jobs, lost their paychecks, and students who won't have a summer job as of early May, that these people needed help immediately. Now we are very pleased to be able to help seniors who also have additional expenses and have had additional expenses for several weeks, and this will continue. On another subject, now with regards to the border between Canada and the U.S., we know that there are discussions with regards to reopening up the border. It's closed up until May 21st. So here's the question. Do you want to open up the border with the U.S. on May 21st? As you said, since the beginning, discussions with the United States have been ongoing and very important to ensure not only that we had restrictions, but also to make sure that goods and services that were essential and continue to be even more essential in the time of COVID-19 could be crossing the border. And this is why we have constant discussions with the U.S. with regards to the border and other shared issues. I can tell you that these conversations are always very constructive and positive. Mr. Trudeau, Christian Noël, Radio-Canada. Seniors are among the most vulnerable. They are facing increased costs that they can't necessarily cover or reduce. Now you're giving them a one-time payment, a maximum of $500, so some will receive less. Why do you think that $500, do you think in your heart that this is enough for seniors? We recognize that there are many people who have lost their income during this pandemic. They've lost their paycheck. Students won't have a summer job. Workers won't be able to earn the money that they were counting on to pay for groceries, to pay for their rent. Seniors are not generally in a situation where they're losing an income, but they are facing additional costs. Also, they have a lot of stress and concern given their vulnerability to COVID-19. This is why we're recognizing that to provide additional help will make a big difference. We will send $300 to all seniors who are qualifying for old age security, and with $200 extra for those who are receiving the GIS. Yes, but if I put myself in the shoes of a senior who will receive a $500 check maximum, if this lasts a year, it means $41 a month, $10 a week. What do you want them to do with an extra $10 a week when grocery costs are rising? We know that we are in an unprecedented situation. We are acting now. If the pandemic continues for 6 months or for a year, we will have to implement additional measures, and we will have to see how we can support seniors, youth, businesses, workers. The assistance that we're providing today is short-term assistance for the pandemic. As you see, as time marches on, we will adjust as needed to make sure that people will receive the assistance that they need.
Seen in this unprecedented situation is we need to remain flexible and support people with what they need when they need it. Obviously, if this continues for another 6 months, for another year, we will have to continue to make adjustments and extend many programs. But right now, what we're looking at is the short-term support that is needed to get Canadians through this so that we can come out the other side and restart the economy soon. And we won't need to look at what we might need to do in 6 months if we're still, heaven forbid, all locked down still. We want to get through this. We want to get through this quickly, but we know we need to support people right now as we get through this, and that's what this extra help for seniors will help with.
Prime Minister Janet Silver, Global News. Chinese Canadians, including human rights advocate Anastasia Lin, say community members are under pressure from the Chinese government for their influence networks around the world like United Front. They fear for family members back in China if they speak out, and they also say that they don't have any support here in Ottawa. And I'm just wondering what your government is doing to expose and stop the influence of the United Front here in Canada.
The Canadian government has always highlighted concerns around human rights and respect for basic human democracies and liberties with every country that we engage with around the world, including China. At the same time, we are strong supporters and defenders of the right to free speech, the right to protest, the right to express themselves here in Canada and elsewhere around the world. We will continue to defend human rights while at the same time looking to protect Canadians everywhere around the world, and this is something we'll continue to do.
We've always been very clear in our defense of human rights, in our defense of freedom of expression and freedom to protest, to gather, and we will always defend the rights of Canadians and others to do that. We've highlighted many times this to the Chinese government and other governments.
Border for essential workers only, allowing only them through, expires next week. A number of provinces like BC and Ontario have said that they don't want that border to reopen. Is there a time period as to how much longer we expect that to be closed, and what's going to be done for the tourism sector that relies so heavily on visitors from the south?
We have every step of the way taken the necessary measures to keep Canadians safe. That has been our priority, and because that has meant negative economic impacts for many sectors across the country, we have moved forward with supports for workers across the country. But our priority needs to be keeping Canadians safe. And that is the spirit in which we have engaged in constant and constructive dialogue with the Americans to talk about shared interests, including the border. And I have no doubt we will have more to say in the coming days on how we continue to move forward in a way that keeps Canadians safe.
Good morning, Prime Minister. Olivia Stefanovich, CBC News. What does Canada need to see on both sides of the border before you consent to allowing non-essential travel?
I think we all are focused right now on ensuring a flattening of the curve, decreasing of the cases of COVID-19 so that we can restart certain sectors of the economy. That must be done gradually. It must be done with tremendous vigilance. And we need to make sure that we have the mechanisms and the materials in place to deal with any further spreads or spikes in COVID-19. Preventing transmission from outside of Canada into Canada once we have controlled the spread within Canada will be an essential part of ensuring that we don't fall back into a second wave that could be as serious as this wave we're going through, or even more so. So we're going to be very, very careful about reopening any international travel, including the United States, before we feel that it is time. Okay.
We know that what we are going through right now is that it's important for us to protect Canadians. We want to avoid the spread of COVID-19 within Canada. Therefore, we need to limit the infection rate among Canadians, and we want to make sure that we are massively reducing the amount of cases. Then, we will also be vulnerable to cases arriving from outside of Canada. We will have to be extremely vigilant and attentive as to how we're going to ensure that COVID-19 doesn't enter into Canada to create a second wave that is similar to the one we are experiencing right now. We will be extremely careful and measured with regards to reopening international travel.
Of Crown Indigenous Relations Minister Carolyn Bennett, because they say she failed to properly consult with elected leadership over a memorandum of understanding with hereditary chiefs, which they are calling your government to reject. What is your response to these calls from elected leadership, and will the virtual signing scheduled for May 14th of this memorandum of understanding still go ahead?
I want to begin by thanking Minister Bennett for the extraordinary work that she has done over the past months and continues to do on a very difficult issue that has gone on for decades now. The challenges facing the Wet'suwet'en are significant in terms of how they engage and how they work with the federal government, and we will always be there with a partner, to listen, to work with them, and to continue moving forward on the path to reconciliation and partnership. Je veux d'abord remercier la ministre Bennett.
I would like to thank Minister Bennett for her leadership with regards to this approach that she used in order to work with the Wet'suwet'en people on these very difficult issues. And these issues have been in existence for decades. As a federal government, we will always be there to work together with this community to try to help them overcome these challenges. We know that reconciliation has to go through respect and partnership, and this is what we're aiming for at all times.
On the big business program for lending, yesterday you said that the federal government will be the lender of last resort to these companies who come to the federal government and ask for money. So that means that banks, private investors, pension funds, they will have presumably said no to these companies. We don't want to invest in you. Do you think that the federal government is taking on too much risk if the market has said no to these big companies already?
I think there are big companies in Canada who employ thousands upon thousands of Canadians for whom the concern that private lenders might have of whether or not it is profitable is not the only issue that a government needs to look at. We know that if significant numbers of Canadians lose their jobs for good because of COVID-19, if big employers go under purely because of COVID-19, because they didn't have the liquidity to make it through this, then our economy not only will be worse off, but we'll have even more trouble getting back to normal and coming roaring back. That is why the government has put forward this large employer emergency financing facility to make sure that those companies that if they were to go under because of COVID-19, and impact on the livelihoods of thousands of Canadians for whom it would not be their fault, our government needs to be there.
We recognize that there are some large companies that have thousands and thousands of employees. This would have a devastating and long-term impact on our economy if they were to go bankrupt because of COVID-19. As a government, we need to be there for the workers. We need to make sure that not only our economy is able to survive COVID-19, but is able to rebound. We will be there to provide help to the companies that are not able to find any on the private markets. We will be the lender of last resort. We know that the impact on workers is too great.
Tax evasion and other things that they've done. Will you commit that the federal government will be transparent about the program itself and make both the terms of the deal and the amount of money that are given to these companies completely public so Canadians can evaluate the deals that your government has done?
Every step of the way, we have been open and transparent about the aid we've put forward during this unprecedented time, and we will continue to share with Canadians the information on what we are doing to make sure that Canadians are kept safe and that our economy is able to come roaring back afterwards. Merci beaucoup tout le monde.
That is Prime Minister Justin Trudeau with his daily address. He's now going to be part of a virtual sitting of a committee of the House of Commons. That's why that happened today at 11 o'clock. I'm joined by Michael Couture in our nation's capital, as well as Reggie Cicchini, who is in Washington. And there's a couple questions there about reopening the border, since the situation in the United States is so different from where we are here in Canada, at least in terms of numbers. We also have Dr. Fauci, who's testifying right now in front of Congress. So we're going to get to Reggie for all of that and the situation there in just a moment. But Mike, I'd like to start with you and seniors, because that was an announcement that was promised for quite a while. We finally heard about this one-time lump sum, $300 to $500, depending on how much the seniors are getting and how much they're struggling. What are the big questions here that remain for you?
Well, the questions are whether or not after this month there will be other aid. Now, the Prime Minister did point to the fact that back in April they did top up the GST rebate, and that was upwards of about, I'm trying to look at it here, $375 per senior and $500 per senior couple. So noting that, look, there is that money there as well. This announcement today, an additional $200 for seniors that are eligible for the GIS, the Guaranteed Income Supplement, and $300 today, as you said, for anybody who is eligible for OAS, Old Age Security. The Prime Minister sort of also noting that, look, we were targeting people who had zero income as a result of COVID-19 to start with. It has been noted by a number of people who have been watching these files that if you are a senior who's on fixed income, that fixed income hasn't really been affected. Now, you've been affected in many other ways, that's for certain. And certainly my inbox has been full of emails from seniors saying, when is he going to announce help for us? This is what it is for right now. The Prime Minister, I'm sure, is open to other aid at this point, but believing that for right now, this is good enough. The question on pensions and mutual funds and, the savings that is eroding because of the financial crisis, I think right now the government kind of has to leave the market to bounce back as it will, as a lot of people are dealing with that, even though a lot of other people who are younger have the amount of time that they can, that sort of lag time for the market to bounce back and that money to come back. So it'll be interesting to see what seniors groups and seniors themselves have to say about this, whether or not they think that this addresses their concerns whatsoever. But I think the question remains whether or not the government will have to come back with another announcement to say, okay, it looks like this is going a little longer, or that wasn't good enough. We're going to add more to to top-ups and more money for seniors.
Mike, I want to pick up on two other things. And these were files that were difficult for provincial governments, for the federal government. There was a lot of talk about these two things for a long time. And that is long-term care standards, which, of course, the Prime Minister today said that this has really opened our eyes. And the other thing is childcare spaces. He said that he would, that the government would help the provinces. How could that help come? Could we see another announcement coming?
Yeah, and I think, as he had mentioned, and you just said, that COVID-19 has really exposed some of the issues that we've had in Canadian society, and realizing that with long-term care facilities, he's committed to working with the provinces when a lot of this dust is settled to make sure that we address that. And on the childcare spaces, noting that the people who have been affected a lot by this are women who need those childcare spaces, and those types of workers as well who occupy those childcare facilities. So I think what the government is sort of looking at here is saying, okay, now we understand what the next thing we have to address after this will be. Once we sort of get through this, once we sort of realize or hopefully get through this with the economy coming back, then they'll start to turn their attention towards that, already kind of earmarking it, saying, okay, these are things that we need to get to. Whether or not it'll be nationalized childcare is another question. That is something that the NDP has been looking for and calling for. But I think it does certainly sort of focus the Prime Minister's attention on these other things going forward.
Let's discuss the border. The situation, as I mentioned, in the United States is very different. The border is closed now. The Prime Minister was asked a couple times when he's considering opening the border. Any indication on a timeline?
Well, he said he expects those discussions or that to come up very shortly in the next few days. We know that the 21st of May is when the current agreement with the U.S. will expire. Certainly, Deputy Prime Minister Chrystia Freeland said yesterday that there are ongoing conversations with her counterparts south of the border to have these discussions on when the right time to reopen the border would be. Freeland mentioned that the premiers and territorial leaders have basically been all on the same page about this and said, we don't need to open this anytime soon. We've mentioned that John Horgan, the Premier of BC, has said, I don't want that border opened at all for right now. Don't even talk about it, because they're worried about the rate of infection in the U.S. and people from the U.S. coming to Canada. And the Prime Minister addressed that, saying that he understands that there are different vectors of this virus and how it could come in. And he kind of opened the door to possibly a hint of what they could be seeing and how Canada could continue even if we open the border. And sorry, worth noting that the border is open. That goods and services, essential goods and services, continue to flow back and forth. It's just non-essential travel. Just wanted to put that on the table. But secondly, the Prime Minister said what Canada could do, because we control who comes into the country, we could decide as the government could decide. I'm not part of the government. I had to clarify that as well. In any case, so the government could decide whoever comes into Canada has to undergo a 14-day quarantine period. And that would be really good at dissuading people, any kind of tourist who wants to come in to Canada. Because imagine if you think, well, I want to go to Canada and see the Niagara Falls from the Canadian side. Well, if you do that, you'll have to enjoy them from the comfort of your hotel room for 14 straight days. I don't know if any tourists south of the border would want to do that. So that is one option that seems to be on the table for the Prime Minister.
And asking your employer, too. I need to take a week vacation plus an extra 14 days, which probably wouldn't fly at most companies. Also worth noting that people who are Canadians who are in the U.S. also can come back here. That's another way the border's open, but they will have to quarantine. Thanks for that. Thank you for that, Michael Couture. Let's talk about the situation in the United States, because there have been benchmarks set by the CDC for opening, and many states are opening without hitting those benchmarks. We also know that Dr. Anthony Fauci is testifying today. Reggie, maybe we start there. What have we heard Dr. Fauci saying?
Hey, Farah, good morning. So Dr. Fauci has been asked a couple of questions throughout the morning, but in his opening statement, that's where he kind of dictated what the New York Times had reported earlier today, that the U.S. was essentially suffering needlessly, along with a number of needless deaths. And that's simply because the government was too slow to act when this virus first made its appearance in the U.S. and then started to become a serious pandemic by the time we headed in towards March. But Dr. Fauci was also asked questions when it comes to to treatments and vaccines. And there was a question posed to him about, could there be a vaccine or some kind of treatment that would be in place that would make it safe to open schools and college campuses by this coming September? And his response was, frankly, I think that would be a bridge too far, kind of pushing back against President Trump's calls to try and have an expedited vaccine prepared to go possibly as early as this fall or into very early winter. Dr. Fauci also making it abundantly clear that there is still an incredibly strong risk, for states to see the number of cases across local levels start to increase dramatically because of the race to reopen here, but also that by the time we head into fall and winter, that it is not inconceivable that this is going to be a second rebound of this virus if testing isn't increased. So this is exactly what Democrats and some Republicans have been looking for, and it is likely going to cause some controversy inside the White House when it comes to the amount of phrasing now that Dr. Fauci has been pushing back that's been spoken by President Trump as of late.
Let's talk about that testing and that information that the president's giving, saying that America is outpacing the rest of the world in terms of testing. Where does testing stand when you compare it to our country?
Well, look, the president came out yesterday and gave a bit of a speech on testing, flanked by signs that said that it's leading the world. And yes, America is now carrying out a significantly higher number of tests than it once was. The problem is they use a lot of comparisons when it comes to South Korea. And South Korea may not be doing things on a per capita basis the way the U.S. is right now, but that's because they increased the amount of testing very early on and their case numbers were able to be significantly flattened. When the U.S. is looking at this either at a per capita basis or at a per 1,000 rate, they are behind areas like Germany, like Denmark, like Italy, and like Canada. On a per 1,000 basis, the U.S. is doing 26 per 1,000 people. Canada is 28 per 1,000. And if you're looking at this as a percentage range, the U.S. has tested about 2%, maybe 3% of their population in and around the same area that Canada is. But a 3% test rate in Canada, is something like 31 or 32 million people untested. A 3% rate in America is roughly 320 million people that are untested, which is why there is such an increased call to broaden the scope of testing. There has been money that was allocated to states yesterday that will allow them to test roughly 2% of each of their populations with the required amount of equipment needed. But there's also unpublished CDC data out there that shows right now across the states there are dozens of cities that are posting infection rates over the last 7 days, somewhere between 70% and in one Kentucky case, more than 650% increase over the last 7 days. This is why health experts, including Dr. Fauci right now, are calling for such an increase to the number of tests that are being run right now.
You look at somewhere, too, this is a side note, like Wuhan, there's a new cluster there, and they want to test all 11 million people there in Wuhan in 10 days. So, testing obviously key to this, and then contact tracing after that. Let's talk about masks, because there is a new stringent mask policy at the White House, and it applies to almost everyone, Reggie.
It does apply to almost everyone except for the president and the vice president. This is a directive that was put in place yesterday that is now going to force anybody who comes onto the White House campus to have some kind of face covering on, be it the media or be it people that are coming in for day-to-day dealings with the president. The mask requirement will not be required if you are sitting at your own desk or you're isolated in your own office. And this is simply because there have been confirmed cases, like we mentioned last week with the president's valet testing positive, also with the vice president's press secretary testing positive, and there's now an increased risk that other people inside the building could potentially test positive. We just had a note within the last 15 minutes that the restricted in-house pool that follows the president around, they're now getting the rapid test given to them once a day to ensure that they're not bringing the infection inside. And that's also because Washington, D.C. itself has become a hotspot around the country. We're anticipating our convention center here to be turned into a field hospital in the coming weeks as we still approach the peak of our curve. But this mask policy, again, not for the president, not for the vice president, and that still causes concern that one or both could eventually contract this virus, and that could cause a political firestorm in Washington, because if both men became incapacitated, third in line to assume the presidential duties would be House Speaker Nancy Pelosi, and that is something that Republicans are very fearful of, and why there is such a strict measure now to ensure the safety of people inside the highest government building in the country.
All right, Reggie Cicchini in Washington. Thanks so much for that. We have some developing news on a story many of you have probably been following. Canadian singer-songwriter Bryan Adams has apologized after coming under fire. Adams posted a video to his Instagram, this one Monday night, performing his hit Cuts Like a Knife, but the caption that went with it got many people outraged. It was a profanity-filled tirade where Adams, quote, blamed bat-eating and virus-making people for making the coronavirus, and he expressed his frustration with restrictions that led to the postponement of his concerts. He has now apologized, he says, and I quote, "There is no excuse. I just wanted to have a rant about the horrible animal cruelty in these wet markets being the possible source of the virus, and promote veganism." He also says that he apologizes to anyone who took offense to his posting. So that is some developing news on that front. Also, the National Research Council has now struck a deal with China to develop a COVID-19 vaccine in Canada. The vaccine candidate received Chinese regulatory approval earlier this year. It was developed by using technology from both China and Canada. It is one of a handful of COVID-19 vaccine candidates that are currently in human clinical trials. Overseas, as I mentioned with Reggie, we're learning more about testing measures in Wuhan province. Officials in the original epicenter of the COVID-19 outbreak have ordered the entire population there, so that's 11 million people, to be tested for the virus after the city reported new infections for the first time since its lockdown was lifted. All districts must now submit a plan to conduct testing on everyone under their purview within 10 days. 6 new cases were reported on Sunday and on Monday. We head to Europe next. The death toll in the United Kingdom is now the worst in Europe. More than 38,000 people have died in the UK. Now more than 225,000 people have tested positive for the virus. Joining me now from London is our Europe Bureau Chief, Crystal Gamansing. Crystal, despite these numbers, the UK still opening.
Yeah, at this point, it is a very slow reopening. People are being encouraged to go back to work if they work in some very specific sectors. The manufacturing sector, construction sector, scientific research. But it's important to note that many of these people didn't stop working during the very restrictive lockdown. At the very beginning of this, there was a lot of criticism and people being upset because construction workers were still working. They were seen as essential workers. So, as you know, it is a bit of a change, but there is that caveat of maybe there are a few more people going back to work, but some of these people never actually stopped. The big issue is also around how are they going to get to work. People are being encouraged not to use public transit, to bike or walk, or if they have to, drive, because they're trying to limit people getting together in small spaces, and also the need to protect people like bus drivers, like those who are in the subway system. So there is a little bit of a reopening. It's very small, it's very phased, and people have been told explicitly here, if that reproduction number starts to climb back up, gets up to 1, they will shut everything back down. So it is a little bit of a change. Of course, people here are very much paying attention to what is going on in other places. You mentioned Wuhan. Of course, that was one of the places that started to open up. People started to go back to work with, again, some protective measures in place, like masks. But we know that this virus will likely have a second peak, according to the experts. And so that is why there is just so much caution right around the world to any kind of restrictions being used.
Certainly. Let's focus back on the UK because, Crystal, there's a divide right now between the UK nations. Tell us more about that, and is there a way forward?
Yeah, this is something that's actually getting a lot of attention, and that's because the UK has said, okay, we are past the peak. We see the numbers continuously dropping. The death toll is still incredibly high, and it goes up every day. However, it's not at the rate that it had been. And so the UK, on Sunday night, Prime Minister Boris Johnson made an announcement saying that, you know, they were sort of moving away from the stay-at-home phase. The new messaging is stay alert, control the virus, and save lives. But, you know, for example, in Scotland, in Northern Ireland, and in Wales, they don't see the same sort of progress being made. And so those nations are saying, we are not moving with this idea of stay alert. In fact, Scotland's First Minister, Nicola Sturgeon, held a press conference where she kept that background behind her that said, stay home. She is making it very clear that the message from her government is that they don't want people going out. They don't want people going back to work yet, that it is just too soon. So we are seeing a fracturing in the agreement that had, for the most part, been between the four nations that make up the UK. And in fact, Scotland has asked Prime Minister Boris Johnson and the UK not to run the new messaging campaign in Scotland, saying that that pertains to England only. So that is something that is being watched closely, and they're trying to sort of maybe the best way to describe it is mend that relationship a little bit. Everyone acknowledges that the virus is at different levels in different locations, and so a little bit of regional allowance needs to be made. But the Prime Minister is saying that at this point it appears that we should be staying alert and controlling the virus. And again, we'll see a few more people out and about tomorrow. People are allowed to go out and spend as much time outside as they would like, easing that 1 hour of exercise limitation that we had seen. Of course, we've been in lockdown here in the UK for almost 2 months.
Wow, yeah, the death toll high, it's just between the United States. Crystal, can we dig deeper on the stages that Boris Johnson, the Prime Minister, announced? So the communication around this virus around the world has been difficult for some to understand what to do when. So talk to us about the stages that are existing now in the United Kingdom.
Yeah, so there was a bit of an unveiling, like I said, on Sunday night. We got more detail yesterday when the document was presented in the House of Commons. A lot of criticism Boris Johnson sent towards Boris Johnson for the fact that he was sharing this announcement before the document was even made public and shared with many trade unions, for example. So what we're being told now is that had the NHS been overwhelmed, that would have been a stage 5 situation. We didn't get to that point in the UK. We were sort of more at a stage 4 situation, which was stay at home, limit the spread of the virus, stay within your family bubble and don't see anybody else. The feeling now is with the death toll slowly starting to drop, with that reproduction number below 1, which is key. That reproduction level needs to stay below 1, that they feel they can start to open things back up. So people are being encouraged to look at this 1 to 5 rating system, and we are moving from a 4 to a 3, and that should allow some of the restrictions to be eased. And so people are being encouraged to keep an eye on that rating system. That is the stay alert point of that new messaging. So people are being told, keep an eye out. We are going to start to ease some of these restrictions. The economy has to start moving at some point, but it just has to be done very slowly based on everything we've seen all around the world for the reopening. And it is being done in a staged fashion. For example, here we're being told that schools won't reopen, maybe some of the very early grades in June at the earliest. Shops likely won't reopen till June, and bars, cafes, probably not until July. So it is a very slow system, a very meticulous system. But of course, people are still saying it is probably too soon. There is a lot of debate and discrepancy between even just the science that is being presented. So people are obviously excited to be able to start to go back outside, but people are being very cautious, and there is a level of fear, Farah.
Certainly. And again, as you mentioned, it's this fear, of course, of a second wave, even when things do return to normal. Thanks so much, Crystal Gomensing in London for us. We're going to go back to Washington because Reggie Cecchini has been monitoring that testimony that we talked about with Dr. Anthony Fauci. Crystal was just talking about the science behind things. So let's get into more of what he said. Reggie.
Yeah, so Farah, Dr. Fauci, speaking of the science, when he was asked by the ranking member, Patty Murray, on the committee, essentially saying the president has been ignoring the information that has been given to him by those in the scientific community, particularly when it comes to reopening the economies. Dr. Fauci kind of said, look, there's a real risk that you'll trigger an outbreak that you may not be able to control, not only leading to some suffering and death that could be avoided, but could set you back on the road to economic recovery. And that is something that is playing out across the country right now as we see so many new cases that are continuing to pop up around the country. It's worth noting here, the numbers that we're seeing on a daily basis are now without those high numbers that we were seeing from New York just a couple of weeks ago. So this is something that is going to be spoken of quite highly and likely cause a bit of controversy inside the Oval Office.
Okay, Reggie, thanks for monitoring that. Of course, we'll have a full wrap on Global National. Thank you, Reggie. Just to recap what you heard from the federal government today, they announced additional funding for seniors, a one-time payment of up to $500 for those struggling as a result of COVID-19. Still a lot of questions, though, about whether this is too little, whether it came too late for one of Canada's most vulnerable populations. This funding announcement is worth $2.5 billion. It's expected to help close to 7 million seniors. Again, a lot more on globalnews.ca. We now return you to your regular scheduled programming. Thanks for being with us.
Okay, so I'll release you to the conference.
Hello everyone and bonjour à toutes et à tous. And as usual, I'll start with the latest numbers on COVID-19 in Canada. There are now 70,342 confirmed cases, including 5,049 deaths, and 33,254 cases, or 47%, have now recovered. Labs across Canada have tested over 1,145,000 people for COVID-19 to date, with about 6% of these testing positive overall. We are now testing on average of 26 to 28,000 people daily. These numbers change quickly and updated regularly on canada.ca/coronavirus. Last week, I mentioned the disproportionate impact and severe outcomes of COVID-19 on our seniors, particularly those residing in long-term care and assisted living facilities. An estimated 20% of Canada's COVID-19 cases are linked to long-term care homes, but over 80% of all deaths are among seniors residing in these settings. I reiterate these numbers today because not only do they lend a voice to the unspeakable scale of the impact on our seniors, but they also highlight the challenges faced by healthcare staff working in these settings. Among these are the nurses. We are celebrating this National Nurses Week, but also the personal support workers and the many other essential staff that deliver care and services to our elders, parents, and grandparents. In our long-term care homes, healthcare workers not only deliver health and personal care services, but they establish familiarity and friendships, offer companionship, personal interaction, and simple human kindness that is as vital to well-being as any medicine. During COVID-19, their work has become immeasurably harder. Nevertheless, they have shown up, and despite staffing shortages and facing their own fears, they've worked long hours, taken extra shifts, and in some cases isolated from their families. And tragically, some of the least compensated and recognized among these, including personal support workers, orderlies, and patient attendants, have lost their lives due to complications of COVID-19. Remember, on this 200th anniversary of Florence Nightingale's birth, shine a light in your window to thank our nurses for the valuable work they do, but make it extra bright for all those who work alongside them around the clock to be there for us when we need them most. Thank you. Merci.
Bonjour. Comme d'habitude,
Good afternoon. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 70,342 confirmed cases, including 5,149 deaths and 33,254, or 47% now recovered. Labs across Canada have tested over 1,145,000 people for COVID-19, with about 6% of these testing positive. We are now testing an average of 26 to 28,000 people a day. These numbers change quickly and are updated regularly on the website canada.ca/coronavirus. Last week, I mentioned the disproportionate impact and severe outcomes of COVID-19 on our seniors, particularly those residing in long-term care and assisted living facilities. An estimated 20% of Canada's COVID-19 cases are linked to long-term care homes, but over 80% of all deaths are among seniors residing in those settings. I reiterate these numbers today because not only do they lend a voice to the unspeakable scale of the impact on our seniors, but they also highlight the challenges faced by healthcare staff working in these settings. These people include nurses, who we are celebrating on this National Nurses Week, but also the personal support workers and the many other essential staff that deliver care and services to our elders, parents, and grandparents. In our long-term care homes, healthcare workers not only deliver health and personal care services, they also establish familiarity and friendships, they offer companionship, and they have personal interaction and provide simple human kindness, all of which is as vital to well-being as any medicine. During the COVID-19 pandemic, their work has become immeasurably harder. Nevertheless, they have shown up. And despite staffing shortages and their own fears, they've worked long hours, they've taken extra shifts, and in some cases, they have isolated from their own families. Tragically, some of the least compensated and recognized of these workers, including personal support workers, orderlies, and patient attendants, have lost their lives due to complications of COVID-19. Remember, on this 200th anniversary of Florence Nightingale's birth, shine a light in your window to thank our nurses for the valuable work they do. Make that light extra bright for all those who work alongside them around the clock to be there for us when we need them most. Thank you.
Okay, thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we ask that you make your way over to the freestanding mics. Operator, over to you.
Thank you. Please press star 1 if you have a question. Appuyez sur étoile 1 maintenant pour poser une question. Notre première question est de Micheline Laflamme de Radio-Canada. À vous la parole. Please go ahead.
Question. Hello. The National Research Council and CanSino Biologics are working together to develop a vaccine. Do you think that that is an important agreement between Canada and CanSino? Is it something that could actually make a difference? And do you know whether there will be clinical trials starting soon and where those clinical trials will take place if they do take place? Answer. Thank you for the question. This is Dr. New. Yes, I think that the agreement is a good example of cooperation among researchers and scientists around the world. It's an important agreement for Canada. It's a candidate for a vaccine. There are a number of candidates for the vaccine, but we always hope to see positive results for any vaccine that's being developed. We don't have any details about the coming steps, but those steps will take place with researchers in Canada, and really it's great news for Canada and also for the international community. Follow-up question. Question. I'd like to come back to the testing. So you were telling us that there are about 26,000 tests daily, but really the Prime Minister had said that our objective was 60,000. So I understand that the right person has to be tested at the right time in the right place, but what would make it possible for us to do what we hoped? Because right now we're at about 30% of that goal. Because now provinces are starting to change their measures, they're starting to relax containment measures as well. Answer. Yes, thank you for your question. So when we were talking about 60,000 tests a day, that would be the lab capacity, but there are always a number of steps to follow. There are a number of challenges on the ground to make testing available. There is also the issue of transporting the tests to the labs, for example. These are issues that we are discussing with our counterparts in the provinces and territories. We are taking a strategic approach across the country, and everyone agrees that all symptomatic people must be tested. And that's something that evolved because at the beginning, with limited experience, maybe back in January, we thought, well, maybe people who have symptoms like a cough and a fever who should be tested. But we've seen, thanks to experience throughout the world and here in Canada, there's a whole range of symptoms. So, with our counterparts, we are now following the judgment of clinicians on the ground. So anyone with any of the range of symptoms could have COVID-19, and therefore they should be tested. So that's the first thing. And now for asymptomatic people, we were thinking that our approach might be adjusted so that if there's someone who's in an environment like a long-term care facility, for example, it would be a good idea to have testing for all of the other residents and for all of the staff if there is anyone who's showing symptoms of COVID-19. In the community, all of the contacts would also have to be tested at home, etc. for a confirmed case. We can see that some provinces are trying things out. They're having pilot projects to screen for COVID-19 cases in certain high-risk environments like long-term care facilities. But we don't have where there hasn't been a confirmed case yet. So really, all of the provinces and territories are increasing their capacity to test. And of course, the situation in Quebec may be different from the situation in British Columbia or in the territories as well. So that has to be taken into account as well. So really, it's up to the health authorities in each province and territory to carry out these measures, to make the decisions about testing based on what's happening on the ground.
Our next question is from Liber Thiaume from the Canadian Press. Please go ahead. À vous la parole.
Yes, thank you. This question is for Dr. Tam. The Deputy Prime Minister said yesterday that traffic between the U.S. and Canada is bound to increase as states and provinces reopen. And we're wondering, from a public health perspective, as traffic does increase across the border, what measures do you think are needed to keep Canadians safe that are not currently in place?
Well, I think one of the key aspects is to continue to strengthen what is in place, because right now we ask that travelers undergo a mandatory quarantine as they come through our international borders, which is, I think, one of the key aspects of the public health measures in order to reduce any risk to the Canadian population. So that, I think, is one of the key aspects of it. A whole host of measures in terms of making sure, I think, that if the numbers do increase, that there is an actual public health system capacity then to be able to follow up and do the proper follow-up of any of the travelers. So I think it is something that we'll have to watch really carefully so that it is not an issue that's going to overwhelm our public health capacity in order to be able to do what we need to do. But I think right now things are working really well. So I think it's watching those volumes as things change over time.
And as a follow-up, if I understand correctly, you previously said that the public health officials are not tracking the number of cases linked to cross-border travel from the United States. You can correct me if I'm wrong. If you do have some numbers, that would be great. But if not, what are the challenges for doing that? What you kind of referenced that this is going to be important. What is the main challenge for addressing that shortfall or gap, if you will?
Well, I think we do track, travel-related cases, particularly in the province and territories, and we have seen that travel-related cases have really fallen off as a result of all of the border measures. So I think it's the ability to, of course, detect any of these cases that's important in any sort of efforts to reopen our economy, as it were. So I think some of the capacity that we've talked about in terms of, the ability to test, track, isolate, and quarantine are still the key cornerstones. Right now, anyone who comes in, provided with a mandatory quarantine order, they have to specify the plan that they have to suitably quarantine as well. Of course, symptomatic people are immediately isolated. And of course, then we track anyone who's actually isolated at the border. But those who are asked to go into mandatory quarantine have a plan to do so. And if they had developed any symptoms, of course, they'll be followed up by local public health. We're also doing, following up to make sure people are complying with the orders as well. And that includes collaboration with our peace officers and others. So, all of that foundation is there as we begin to see if there's any increase in volume.
Thank you, Operator. Next question on the line.
Notre prochaine question nous vient de l'inaudible de la presse canadienne. À vous la parole, please go ahead.
Yes, hello. Dr. Tam, my question is for you. I was wondering, at this point, what is your scientific advice to the government about reopening or not the border with the United States at this point?
So I think, as with all aspects of this next phase, is extreme caution and really be very, very careful because this virus could take off rapidly if we do not be extremely slow and cautious with our approach. That's any aspect of domestic or international sort of easing up, if you like. I think that one of the sort of underlying principles with provinces and territories is that we need to be able to see what happens when we ease the domestic public health measures before we can essentially look at the international border easing up. So that's another principle that we have discussed with the provinces and territories. And of course, having the ability to, again, to detect and trace contacts, quarantine and isolation are still, very important, and looking at our health system capacity. But it also depends on us tracking the international epidemiology, because the virus is in, essentially all countries and jurisdictions of the world, and they're all at different stages in their epidemiology. So part of that will be looking at that aspect of what's going on in the other country. And of course, the United States being one country that still has cases and is still trying to manage outbreaks. So, and they present a risk to Canada from that perspective. So we have to take that into account.
Thank you, Lena.
Okay, yes, thank you. Well, you know what? You gave me enough on this. My follow-up would be on testing. So at one point, not so long ago, like a day or two ago, you were saying we should not be testing too much because we're going to get false positives. We shouldn't be just testing at random. And now more and more people are saying, in different provinces, are saying we want to test more. We want to test non-symptomatic people. We want to test in the community. So has your thinking around that changed? Should we be testing more as long as we have the tests? Should we be testing more?
Well, I think as things and public health measures ease, we know that we have to have the ability to rapidly detect and cases and deal with contact tracing. So that capacity must be there. So I think we have to, right now we're having an active discussion with provinces and territories as to, well, what more can you do on top of the diagnostics and case and contact tracing, which has to be absolutely paramount. Is there areas such as high-risk settings like long-term care facilities where some jurisdictions are looking at more of a screening approach, such as what Ontario is doing right now. So some of these aspects are being actively discussed. But on the whole, one of the key strategies is to widen the symptom list, if you like, and be able to test anyone who has mild symptoms. That is casting the net a lot wider than, of course, in the middle of the epidemic, when we essentially ask people with mild symptoms to stay at home and wait out their symptoms, and many of them were not tested at that stage. And so in this next phase, the initial increase in testing is going to be focused on that aspect.
Thank you, Dr. Tam. We'll now come to the room for the next question. Mackenzie?
Hi, doctors. Mackenzie Gray from CTV News. One of the things that government departments, airlines, lots of other businesses are looking at doing now to determine whether or not people are ready to go back to work is taking their temperature before they come into the store, go into work. Can you speak to the effectiveness of whether or not someone's temperature is a good indicator of whether or not they have COVID, and whether or not it will help us be able to detect people who have asymptomatic cases of the virus?
Yes, I can comment. So maybe going backwards from what you just said, if someone's asymptomatic, obviously a temperature check is not going to detect anyone who's asymptomatic or pre-symptomatic. And people can also have very vague symptoms that, that doesn't include a fever, for example. So those people will obviously not be screened. And so then you're left with potentially someone who with an actual higher temperature. So that at that point, if you had someone with high temperature, you can't tell at that moment in time what that higher temperature is due to. But you can certainly turn people away as a result. But I think some follow-up may need to be done, because people can have a higher temperature for all sorts of reasons, whether naturally, and they're well, but their temperatures go up and down as a result of different activities or their different health conditions. So it's not a very specific means of screening, of course, as you can imagine. And it's not very sensitive because of the nature of the illness. So those kind of characteristics have to be borne in mind, because it's very difficult to interpret that one way or the other.
My other question is about seniors' homes. Obviously, you guys have mentioned this on a number of occasions. What concrete things would you like to see seniors' homes, long-term care homes, any facilities where we have vulnerable people living there, what would you like to see them do as we go on the downward cycle of this wave and potentially going into future waves so we don't see the large spikes that we've seen in these homes?
Yeah, so I think from our perspective in working with the chief public health officers or medical officers of health is to put down some guidance which do have to be implemented by the different facilities. In terms of prevention, really, the key is to prevent the entry of the virus, which is, can be quite difficult because of the asymptomatic and pre-symptomatic infections. So some of those guidance also include the use of PPE. For example, for staff for the whole shift that they're there, because you actually trying to prevent introduction by staff, between staff, and also essential visitors or visitors to the care facility also has to practice infection control measures. But of course, people like to focus on the PPE, but there's all the other controls, the administrative controls and who goes in and out, tracking who they are, the physical controls of spacing. So, I think no congregate settings or, having meals without physical distancing. The activities have to change within those long-term care facilities so that the spread doesn't occur. Environmental cleaning, all of those aspects are there to try and prevent the introduction. But the other administrative and support that provinces are beginning to, it's try and stick to one single facility for staff working there, which has been a bit of a challenge to do because many of the staff, because of their relatively low-paying jobs, they're actually working in between different facilities or between the facility and an acute care and a home care setting. So they're trying to reduce that so that that spread channel doesn't actually occur. So it's really multiple layers that needs to be done in order to support long-term care. The moment you detect a case, and Dr. New just spoke to that is where low threshold testing of everybody, including asymptomatic people, I think, then becomes extremely important.
Thank you, Dr. Tam. We'll go to the line for one final question. Operator.
Thank you. Our last question is from Rahul Vidianath from the Epoch Times. Please go ahead.
Yes, thank you very much for taking my question. I would just like to ask you, how critical is the shortage of vital medicines at this point in time? And I understand it's getting worse. And what can Canada do to protect its supply chain of vital medicines, including diversifying it away from Chinese production, which has something like a quasi-monopoly on the manufacture of active pharmaceutical ingredients?
Thank you for the question, and I might not be in the best position to answer that, but I know that our Health Canada colleagues monitor and facilitate the sort of constant discussions with the province and territories on any signs of any kind of drug supply or essential supply issues from that front. So I know that there are mechanisms through which they are monitoring this very closely, and I think they're looking at different strategies. Just as we have with public health supplies like lab supplies or PPE in the healthcare sector, I think exploring all options, including domestic capacities, is part of the approach as well.
Thank you. And your follow-up?
Thank you. And we've obviously heard many reports of receiving faulty PPE from China, not just Canada, but other countries. But what is your level of concern about the actual medicines that are being made there, given that you can't do on-site investigations during this pandemic?
I think, again, any details, I think I would defer to our Health Canada regulatory colleagues. Of course, Canada has a robust regulatory regime, and that is there to ensure that medicines meet certain standards and requirements. And I know that Health Canada colleagues collaborate with other international regulatory authorities as well, whether they be the European Medicines Agency or the US FDA. So they have different mechanisms to try and ensure that Canadians get safe and effective medications.
Okay, apologies, doctors. We're going to come back to the room for one last question.
Hello. Sean Kilpatrick with the Canadian Press. We're seeing this term, the new normal, being thrown around. I'm wondering what both of you see as what the new normal is going to be.
So I think it's the recognition that we have not eliminated this virus, and that it is in all countries in the world. So we also are looking towards things like serological surveys to see how much of the population maybe have been infected with the virus in the past. But I would suspect, just based on international surveys so far, that percentage is going to be relatively low. So there's going to be a lot of unimmune people in Canada. So the new normal means that we have to be extremely cautious about relaxing public health measures. And provinces are phasing their relaxation of certain measures according to their own context and epidemiology. So I think the pathway to this new normal has to be extremely cautious, where you have to monitor what actually happens and evaluate what happens when you do that. But the new normal means that Canadians, every one of us, must continue to observe some very core public health practices, which one of the most difficult is staying home when you're sick. And I keep saying that isn't sort of in our general behavior before this actual pandemic. And people need to be supported to do that. Washing your hands, we cannot talk about it more often. The physical distancing means that we are not going to see mass gatherings anytime soon, not until we have a very good handle on what is going on. And provinces are continuing to look at their advice on maybe small gatherings, particularly ones of importance to the cultural, social context of Canada, but doing those small gatherings in a very safe manner. So you have to actually change your approach to some of those gatherings. Going outside is okay, but you still maintain your own little cluster or bubble, but a distance from others. That's still going to be there for a while. Non-essential travel, we're not going to see that happening. We hopefully are capitalizing on what we learned about telemedicine, telework, so that workplaces could look very, very different in this new environment. And you will see grocery stores with the social distancing measures, plexiglass to protect workers, etc. So I think that's very important. So I think a lot of what fundamentally characterizes Canadian daily lives will not look the same as before, as I said, before January of this year. And so listen really carefully to your local public health authorities.
Your follow-up?
Yes, my follow-up is just in the near future, you talk about us having to move slowly. How slow can we move and it not affect mental issues and economic issues?
I don't think there's an actual measurement for the, it's not like a car where you sort of have to look at how many kilometers an hour that we can drive. I think different provinces have very different situations right now. So if you are in the Yukon or PEI, you're quite different from if you're in Vancouver, where you can see the medical officers of health being very cautious about what it is they do. They have phased approaches. Each jurisdiction have certain phases according to their context. If you're in Montreal, you're in a very different position right now. You're still dealing with outbreaks while cautiously looking at what is happening in the community. And the rest of Quebec is different to Montreal. So I think the rate at which certain public health measures are eased will fundamentally depend on where you are in Canada.
Thank you, doctors. That concludes today's conference.